Right. Well, I am quite certain we will still have some additional folks joining us, but in the interest of time, I think we will go ahead and get started if that is okay with our presenters. So welcome everyone to the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference, Equity from the Start. My name is Lauren, and I will be your facilitator today. And I'm joined by Leslie, who will serve as our technology host. The session is being recorded. You should have just seen that little pop-up that came through. Transcription is available through the Zoom platform. And if you have any questions, please go ahead and put those questions in the chat. And we also want to let you know before we begin that the views, policies, and opinions expressed in this presentation are those of the authors and do not necessarily reflect those of SAMHSA. And right now, everyone coming into the session is muted, but you can absolutely use the chat. We encourage you to use the chat. And when we get to Q&A towards the end, if you would like to come off of mute, you just raise your hand and we will go ahead and unmute you. So with that, I don't want to take any more of this short workshop time talking because we have an incredible presentation. So I'm going to hand it right over to Mary Mackrain, and she's going to get us started and introduce the other presenters today. Thank you so much for joining.
All right. Thank you, Lauren. Thank you, everybody, for being here this afternoon. I know most of you have probably been in sessions for most of the day, so thank you for joining us late in your day. Again, I'm Mary Mackrain, and I am an infant mental health consultant for the Michigan Department of Health and Human Services. And I was just thinking about this morning. It's been 25 years. I started out as a mental health consultant in the 90s, and I'm still here plugging away at this wonderful work. So appreciate you all being here. So today we're going to talk about grounding infant early childhood mental health consultation and early relational health. It may be a term that you've been hearing, and we wanted to dive in a little bit with all of you this afternoon. And I'm joined by David Willis and Hoda Shawky, so I'm going to let them introduce themselves. So David, I'll turn it over to you.
Sure. Thanks, Mary. And I've been in this business for a long time, too. So it's great to be a part of being able to share with the audience that's listening in. I'm David Willis. I'm a pediatrician, developmental pediatrician, and a senior fellow at the Center for the Study of Social Policy, working to advance early relational health, cross-health health system transformation, and communities. Hoda?
Hi, good afternoon. My name is Hoda Shawky. I am a pediatric nurse practitioner and lactation consultant, and have been working in maternal child health consulting for the past 4 years. And I'm also a student in the UMass Early Relational Health Fellowship.
Great. So David is going to start us off today. So David, I'll turn it back to you.
That's great. Thanks, Mary. You know, all of us in this room know relationships matter. And we also know the power of relationships, especially around being connected, as to both not only provides opportunities to build well-being, but also buffers and protects. And just as a reminder, you know, it only takes one human relationship that is deeply in love with another that helps weather that adversity and protect the youngest from harm. It's those simple daily interactions that really matter, that help build health and development. Nobody's perfect. That rupture and repair process in important relationships is what we all know really matters. When we talk about early relational health, we're really talking about the foundation of lifelong health and well-being is centered around early relational health with those safe, stable, and nurturing relationships that give rise to infant and early childhood mental health. It's not really a new concept. For some, it may be a new term, but it's really about bridging and broadening the opportunities we all know about of advancing this relational frame across early childhood. And it builds upon all of our wisdom and practice and research across all of our fields of early childhood mental health, child development, neurodevelopment, and we're really shining a spotlight on that essential element of focusing relationally, building the networks and the partnerships and the broadening workforce needs to build out that relationally centric effort about early childhood. Next slide, Mary. And again, around definition, we're talking about that emotional connection that goes on between the caregivers and young infants and toddlers that are all supported by that positive and nurturing experiences. All of that about building that foundation of lifelong health, well-being, and flourishing. Next slide. And we know that it's this process of relational health is a two-way impact for a caregiver as well as for that infant and child. That bidirectionality really matters, and thereby all that we talk about focuses on that foundation of the context that support the relationships of the ability then for children and caregivers to thrive now into the future. And all of you that works with families, especially sometimes those that are most marginalized and stressed, some will say that that moment of being in relationship with their young ones is the most meaningful and powerful moments. And we have science that talks about the building of the caregiver's brain and health and abilities and capacities, as it does also for infants and children. That bidirectional nature is essential to this relational health concept that we're also helping to elevate. Next slide. And we all know that the context of human development matters far beyond adversity, far more thinking about the context of the community and context and environments that can make it really difficult for families to thrive. So when we talk about early relational health, we're mindful of the context that surrounds families. We're mindful that all families would wish that their young children and themselves do well, but sometimes the adversities make it really challenging. But we also know that surrounding families and communities with strong relational supports and the buffering element that can bring to help build well-being through strong, safe, positive, and nurturing relationships. And the next slide calls out this opportunity that's come forth from the American Academy of Pediatrics that's made visible that partnering with families and communities to promote relational health with all that we know from the fields of infant and childhood mental health, child development, and the like, now is really central to building next generation thriving, preventing childhood toxic stress, and building well-being. And they actually called out last year that pediatric healthcare is on this cusp of what they call a paradigm shift. But for us in infant and childhood mental health, it's not a paradigm shift at all. It's really accentuating and expanding that work in terms of engaging child health systems, thinking about reprioritizing clinical activities in partnerships, rewriting research agendas to broaden the learning together, and to realign and expand that collective advocacy that we've been doing around infant and childhood mental health work and in child development work, and about building out a collective advocacy to promote this relational frame that matters to all of us. The next slide. There's already work going on to advance this relational health in action. Not only all the good work around promoting literacy that's focused relationally, like Reach Out and Read is doing, about harnessing those first relationships in pediatrics to build out that therapeutic alliance of partnering with families, building on the keystones of child development that are coming out of Mount Sinai and the good fan work that Erickson and Linda Gilkerson has made visible. All of that is a part of the relational health advancement work. And the movement in child health system transformation is about building out team-based care models. Not only the Healthy Steps models with specialists in the medical home to partner with families around their well-being, but also the Dulce model, which brings in a universal platform of community health workers out of the community, medically involved partnerships in the first year to support families in terms of building their strengths and well-being and linking to communities, and as well as meeting their daily needs and supports, but also that building the connecting points with community health workers, the community-based doula work and home visiting as a part of building out a medical home linked deeply with communities and partnering with families is already that relational health work in this moving forward. And there are communities that are really elevating that all-in strategy about a place-based initiative to build an early relational health work. And we're building additional tools that people are aware of about circle of security parenting, the video interaction projects, and those efforts around broadening from the ABC model into communities. All of these efforts already exist, but they're not built out in terms of broadening strategies. So next slide, Mary. We've had a policy platform that we've made visible about this cross multiple strategies of policy advancement that includes infant early childhood mental health consultation, broadening the relational health work, health force, broadening system building efforts, this high performing medical home, all within the concept of equity. And the next slide, we just put out a paper through our Nurture Connection website that looks at the policy space and a 50-state analysis of how these policies that can help support advance this, broadening relational health opportunity, partnering with so many others. That opportunity is really growing in our efforts, and we're really excited about how this work is broadening to move this agenda. And next slide calls out with our Nurture Connection network that has many of field partners across sectors calling out this movement of early relational health and the messaging frame of the messaging element that nurturing connection early really matters. And we built a coordinating hub at CSSP that has 6 key strategic priorities, one of which is partnering with families intentionally as they guide our learning together in terms of building meaningful messagings and activities. We value the importance of place-based strategies that bring an all-in strategy of multiple partners locally, including parent leadership, to advance this work about a relational frame. We believe in the power of workforce development, being cross-sector, multi-sector, and there's been work that's in advancing a relational health frame in the community health work in Washington State. We've got work advancing the doula networks that you'll begin to hear about. And then we've also been moving and building a research agenda with our colleagues at Columbia and Reach Out and Read about how we can demonstrate collective impact efforts as well as implementation efforts, and then looking at what are the core mechanisms that can build from all we know of attachment, all we know about dyadic work, all we know from the synchronous efforts about building their strong relational framing and the healing forces that are really important. And then we, as I noted, a policy advancement that's visible and this messaging frame into more and more sectors about nurture connection, as well as the power of a relational health frame, building that social movement of all partners, recognizing that the shift beyond just focusing on the individual and individual autonomy and well-being, all of that has to be in the context of a relational and connected counterforce to isolation and to the isolation epidemic that's in front of us, and messaging about nurture connection matters. So the next slide, please, is building out this sense of a social determinant workforce that focuses on relational elements that connect with not only infant mental health clinicians and consultants, but the family developmental specialists, family service workers, community health workers, home visitors, trying to build out further and further in communities, in the families' experiences. I'm behind prenatal to 3 spaces about that relational health workforce. And that's next slide really talks about the work that we're doing in terms of building this forward. So I suspect that all of you can see yourselves in some of this work. And we're really eager if you might lean in into the chat. What are some of your day-to-day activities that excite you about this relational health frame that you might share with us? So if you could take a moment and add into the chat what you're already involved in, or what excites you about what we're talking about in this space that you might share with others. So if you could chat in the chat, we'll call out some of your thinking until we move to the next element of our presentation. Let's start. Who'd like to add into the chat some of your thoughts? Don't be shy. How does this ERH work relate to your day-by-day experiences? What excites you? Love supporting families and connecting them with resources. It's all about relationships. I can picture this in our rural community. Seeing how children develop and progress over 2 years, especially when they're connected. I love the wording, so much intuition around the words and the space for all of us. Listening to other people's journeys is my favorite part of the day. Their narrative, their hopeful narrative shared with us is really valuable, isn't it?
Mhm.
And infant early childhood mental health consultation is all we do in teaching and exploring and advancing this work. Many know about Circle of Security parenting programs, Circle of Security classroom programs, advance, and it's exciting to advance this work. Supporting relational building with parents and their children is what we all believe in, and it's amazing to watch. I love seeing ERH gain research, a research base to broaden and grow across all of our networks. And then Erin says, as an infant teacher, I get to spend more and more time with a child and as their family does. The relationships I have with them matters to me. So Mary, can I come to you again? What's our next album? Keep adding to the chat as you wish.
All right, that sounds great. All right, everybody, we're going to move along and share another example of early relational health from Hoda. And then I'm going to dive into some of our work that's happening in mental health consultation in Michigan. So Hoda, I am going to turn it over to you.
Thanks, Mary. And thank you everyone for sharing in the chat. I'm excited to share about the doula work, which I think has a lot of similarities in what has been shared as well. Because as part of the project I'm involved with, it's really elevating the impact that doulas have within the early relational health workforce as well. And so just for little definitions, I wanted to provide that doulas are non-clinicians trained to provide emotional, physical, and informational support for people before, during, and after the labor and birth. So birth doulas provide hands-on comfort measures. They share resources and information about labor and birth. And then they also facilitate positive communications, not just with the birthing person and their birthing facility, but also within the family as they're exploring this new child that's been born. Community-based doulas are individuals who come from communities in which they work, and they offer services tailored to the specific needs of their clients at no or at very low cost. In addition to the regular doula services that they provide, many also provide support with attachment and responsive parenting. So in the next slide, I wanted to share with you some profound outcomes from the impact of doulas, and this was shared by Open Arms, which is a program in Washington State serving the perinatal communities of color. And you can see this recent data, just phenomenal outcomes as it relates to higher rates of full-term births, healthy weight births, and then initiation and continuation of body feeding after birth. So these rates are quite inspiring, and there is a lot of research around the country that's similar in terms of the outcomes that we see among perinatal clients who are receiving support from community-based doulas. And so it really encourages us to be paying more attention to the roles that community-based doulas are playing to help their communities achieve these really great outcomes that are setting the foundation for lifelong success. So I'm going to share with you what we've been learning from a project that is intended to develop a training curriculum by Health Connect One, which they offer to community-based doulas. And the purpose of our project has been to really deepen the knowledge and skills around early relational health. So we started our project by really listening to doulas. to inform our work and to really understand what it is that's early relational health based that they're already doing with their clients, because we knew that they were doing so much. And so we surveyed 160 doulas nationally. And this slide shows that the majority of doulas aren't just ending their relationship with the clients at birth. A lot of them are continuing to support their families after the birth. So now we can go to the next slide. So it was no surprise when we found that 90% of the respondents saw themselves as playing a role in promoting early relational health. 2/3 of community-based. So we shared the definition of early relational health through the early relational health core story that's on Nurture Connections. And what we found is that 2/3 of the community-based doulas who responded to our survey found that the work they do that their understanding of early relational health really matches the definition that we shared. And 1/3 of the doulas who responded said that they incorporated early relational health concepts into their work, but that the term wasn't widely used. So it was something that doulas have been doing for quite a long time, but maybe they didn't refer to it as early relational health. Additional questions from the survey confirmed what we knew all along, which is that the reason why the work of community-based doulas is so impactful is because the relationship is at the foundation. Everything that they do is relational. So they support clients in recognizing and healing intergenerational trauma that may harm the early relational health that they're establishing with their baby. They engage in safe, non-judgmental communication with clients. They listen attentively to affirm decisions and emotions shared by their clients. They support their clients' healing processes. And they assess when clients need resources beyond the scope of work, especially when it comes to mental health. They establish a trusting relationship that provides clients an opportunity to unpack their personal histories and their narratives. And doulas aid clients in the restorative process with a deep sense of care and vulnerability as doulas share their own personal narratives, because, again, many of them are coming from the same communities and can really resonate with many of the experiences that their clients have. So in hearing the doulas speaking about all of this important work that they do within their communities, we began to wonder, so how are they sustaining themselves in the physically and mentally and spiritually tasking work of being a community-based doulas? If the doulas are working to hold all of the relationships that are surrounding the baby, who's holding the doula? And so that's really the question that we took to heart when we developed the training curriculum, which consists of two modules. And so on the next slide, you'll see a description of the first module, which shares some of the outcomes. And we called it the Nurture Connection module. And this is really to support the knowledge that around early relational health and why it's important. And then the second module, which is on the next slide, is helping to deepen the skills that doulas already use with narrative storytelling and healing to incorporate their early relational health knowledge with some additional skills that can help support them, and specifically in providing those safe spaces and holding their clients, and more importantly, in the ability to hold themselves. And so we have already, Health Connect One has already trained 35 community-based doulas in the two pilot cohorts. And the feedback that we got was that they really appreciated most the power of learning and healing in community with other doulas. So doulas really appreciated the opportunity to role play so that they could practice some healing skills with each other, as well as experiencing being held by other doulas. And what we are learning is that this project has really lifted up the importance of being able to access reflective consultation and reflective supervision, again, because the doulas are doing so much for their communities, but there aren't often opportunities for them to access supports that can really help sustain their ability to continue this work because of the intensity of the experiences that their families go through. So we're really excited about this work. We're really inspired by the doula workforce and holding what we're learning from the doulas as we think about the strengths and needs of the broader early relational health workforce. Thanks, Mary.
Do we want to pause for a moment here, Hoda, just to see if anybody has any thoughts or questions?
Sure, great idea.
So we'll just give it a pause again, just to let it all come in and give you a moment to reflect. Any similarities that you all see to the work that you're doing in mental health consultation? I know when I saw self-regulation, healing, and empowerment, I'm imagining many of you are thinking that seems pretty in line to what childcare providers, home visitors, and others that we support really need as well. I'm just going to check the chat, see if there's any.
I'm curious too, Mary, whether there's anyone out there that's had any experience in providing consultation to any of the doula networks or individual doulas themselves. That would be interesting to hear about.
Yeah, we'd love to hear from them.
All right. Well, just looking at time, it's never too late to put something in the chat. We'll monitor as we go along, but I'm going to move us into some of our Michigan work now, and then we'll have some time for Q&A at the end. So as you heard from David and Hoda, I think the message in many ways is we're in this together. Relationships matter no matter where we work, no matter what we do, and it's so important that we're developing these relationships, obviously together with our families, right? And really learning from them. So I wanted to share a little bit about our work in Michigan. Our mental health consultation program started in the mid-90s, so we've been at it for a long, long time, but that doesn't mean that what we did in 1996 works in 2023. And one of the challenges we put to ourselves is to really look at who does our model work for, right? We have these fantastic outcomes. We've been at this a long time, but have we really dug into our data and disaggregated and really talked to community members at the level we need to address accessibility and equity and look at our outcomes and how they're impacted by low-income bias, racism, and ableism. So we have a lot to learn, and we wanted to be brave and open and transparent to see what are we going to find out and what changes might we need to make. So our Michigan Department of Health and Human Services, where our infant early childhood mental health consultation program lives at the state level, we contract out to local community mental health services providers. At the state level, we wrote a proposal to the Michigan Health Endowment Fund in our state to really help us explore racial equity and how our resources for consultation are distributed across the state. So at the time of this study, we were in 18 counties of our 83 counties. So oftentimes you hear that our Michigan program is statewide, but we're not in every county of the state, not yet anyway. So we did a deep dive into our data that we've been collecting for many years. We had conversations across communities with childcare providers, consultants, state leaders. And then we really looked at aggregating this information to see what are some of the things that we may need to change and we may need to grow. So I'm not going to read all of this to you, but I'll just call out some of the things that we have been learning from this study. In our theory of change, we look at 4 different components. We look at advocacy. So we look at our messaging, our communication to really reduce that stigma. We look at our model and how was it created and are there any pieces that we really need to change? We look at our workforce and how they're supported, the diversity of our workforce and how we're growing them. And then we also look at an area of funding, always looking to cross-system funding. So we're never reliant on any one source, because we all know if that source goes away, we have no program left. So we want to make sure that we're looking at diversity there. So some initial findings that we have been learning, and I don't think this is going to be unique to Michigan, so I'd love to hear from all of you, is that in many of our communities, there are very unique narratives of stigma when it comes to hearing the term mental health or infant early childhood mental health. It still brings up visions of maybe services that grandparents received years ago, other children received years ago, and it wasn't always so positive. So what we heard is people really want to turn to look at wellness and connecting. People also shared that it would be nice to have some kind of collective grounding around relationships, creating a shared narrative. So what we gather from that is that we have this infant early childhood mental health consultation program that lives out of a state infrastructure where we created the model years ago. And might there be a way to have some kind of shared collective growth of this work that everybody can hang on to and grab onto and be a part of? So that's how we got to early relational health. We also heard that if there could be more explicit training to really reflect and address implicit bias and identify challenges together. That means with parents, childcare providers, clinicians, and consultants doing it together, and really working on how we rethink, reframe, and reconstruct together equitable access to all of these wonderful services. So we've thought deeply about this, and where early relational health comes in is really around creating wellness and connections, a collective grounding where we're all starting at the same place around relationships, to rethink and reframe how we talk about this work and how we do it to access everybody, and then intentionally integrate our families and providers into the solutions. So we really see early relational health as something foundational, as a strategy that we can really leverage to make sure everybody understands the importance of relationships. But we're really invested in doing this with families as our partners, and in some cases, really as our leaders, to do it differently through storytelling, through TikTok videos, the way that we learn today, where years ago we started with modules and guidance documents. And I think that some of those practices and methods are just not working the way that they used to. So we recently conducted a survey in Michigan to really learn from the field. What is it about early relational health that is important to you and actually very meaningful in our work? We have now over 3,000 respondents. You'll see how they kind of march out. So one thing I'm very proud of is we have over 600 parents that completed this survey, and over 1,000 child care providers and other professionals. So these are some snippets of what we've learned and what we hope to do. So I just wanted to put a quick slide in here around race and ethnicity of the different respondents. We are now going to be starting disaggregating this survey data based on race and geographic region to see where the differences lie. We've done a little bit of that so far, which I'll share. So some ideas from the parents. So again, I'm not going to go over all of our questions. We will be sharing some of these results more widely, but we asked parents, what does a provider do or say to you that really indicates they're noticing and honoring your relationships with your child? So this could be a clinician, a consultant, a home visitor. And they said things like, they care about the boundaries that I've set in my family. Just showing they care or pointing out things that happened that were good. I can't tell you how many parents said, please notice what I'm doing right, or that I'm making an effort. It's really important. When we asked what they would like providers across the different realms of early childhood to do, they want you to acknowledge, us all to acknowledge strengths in their relationships, honoring their values, the way that they parent, just demonstrating that active listening and attentiveness, showing that I see you, I hear you, I think about you. Noticing the child's qualities. And I don't love this, that this came up as a theme, but enough parents said that that providers don't notice at all. And that's an improvement that they could really make. And that's a hard thing to hear. But it makes you think, as maybe a mental health consultant or other roles that we do, how many times or how much can we just go in and actually sit on our hands, assume confidence or competence, and just listen. Sometimes that's all the family is saying that they need for that particular day. Some other key themes. One parent quote said, "I would like providers to talk to us instead of at us. Sometimes it feels as if they could be reading off of a script." So people want resources, respectful communication, more time, more engagement, sitting on the floor and just experiencing day-to-day life together. So oftentimes what I realized when I saw these results is it doesn't really take more time, more funding. Sometimes it takes just putting a few things aside, taking a deep breath before we go into a visit or a classroom, and just putting on our ability to actively engage. So I'm not going to read all of these. I'll just call out a few, but we asked this question: if you could create one meaningful change in how providers honor and support your relationship with your child, what might that be? What would real aspirational change look like? It would be demonstrating respect without judgment, having more opportunity for conversation and relationship building, providing parent-child relational guidance. So, when I talk to home visitors and childcare providers and other consultants, sometimes it may not be any of you on the line, but I have heard from quite a few people, I notice relationship interactions. Sometimes it's positive, sometimes it's not. And sometimes I'm not comfortable being in the space of discomfort and narrating and having that conversation about the quality of relationships. And what parents say is, please talk to me. This is important to me, even if it's uncomfortable. Let's try it out. Let's try it on. So that was really interesting information that we learned. When we asked about what gets in the way of that joy, I think some of these things will be familiar to you. Child behaviors, life stressors, job issues, busyness, financial stress, and illness. I'm sure you all can come up with many, many more things that can stand in the way of relationships. So I'm going to just pause quickly. I've got more to share with you, but is some of this resonating with you, those of you that are doing infant early childhood mental health consultation? Anything that the parents shared, or some of these stressors, do these resonate with you at all? Or any other thoughts that come to your mind about what can get in the way of the joy of relationships with those that you support between adults and children? Just give it a minute here. I have to practice what I say and sit on my hands and give people a moment to respond and reflect for a moment. Yeah, definitely hitting on the key areas, definitely stressors. Yes, there is a way to see the survey as a whole. I'm definitely, we can share the questions. I know others have asked for those too. Definitely depression, right? That's one that can definitely get in the way, and we want to be talking about that.
Michelle, you've raised a really interesting comment, and I so agree. How many parents out there, no matter what socioeconomic level or whoever they are,
Yes.
doubt themselves at times as parents? right? It's almost cultural. It's almost societal. That sense of judgment, the sense of, am I doing okay? The uncertainty of knowing becomes really a part of how do we be in that space with families and talk about the strengths that one actually sees and knows, and yet talk about the doubts that every family experiences.
It's true. So many providers and parents have said, I want to know what you're observing. Sometimes we're writing in our book or taking notes, and that ability to just be able to say, when you sat down on the floor with your little one and they looked up to you and you looked back and that smile came out, wow, you're really connecting. Just those little pieces of feedback, you see the tension loosen up in that adult just a little bit. Or even to say, your shoulders tensed. I saw you look away when your child didn't answer to his name. What are you feeling right now? So we're just getting a little bit more at what it is we're seeing and what we're hearing together with families about those really important interactions.
Katie, your comment about feeling like professionals don't match their culture, there's a lot to learn there. That, the cultural congruity, or also, the lived experience shared and understood. One of the things, Hoda, I don't think you mentioned it, but what I was so struck by with doula work was that the number of times that doulas say that they walked into the first relationship with a new pregnant person sharing their own birth story, walking in with their own narrative to ground the relationship in a shared mutual experience was really striking as a way to build relationship that is really connected at the person-to-person level.
That we're human. We're all human, right? We've all had bad parenting days or bad days ourselves. It's important. So this time slips by much too quickly. So I'm not going to cover every detail on these slides, and so we can give you a minute or two for questions. We did get some great provider responses. You can see that providers think it's very, very important to support and speak of the strengths and love between parent caregivers and their child. We saw no difference by race. It was very interesting when we asked how well the training that all these different early care and education providers received related to early relational health and how helpful it was. You could still see there's a lot of room for improvement, right? And like David said, early relational health might be a new term, but many people are learning about relationships in their work. At least in Michigan, I will say, child care providers felt their training prepared them more than mental health consultants and our clinicians in our state for supporting early relational health. There could be lots of reasons behind that. We do a lot of social and emotional and relational health training in our state. There might be a little bit more that we can do to strengthen some of our other areas. I am going to move to our themes because I think this is important to our work. When we think about what kind of learning series around early relational health do people want and need? These are the kinds of things that started to come out in terms of what people want more of. They want to know how to have more relationally focused conversations, understanding cultural practice differences in early relational health, as somebody already mentioned. They want to have parents and providers being trained together with us around early relational health. Capturing the wisdom from career providers on promoting early relational health, and video examples, resource guides, and so forth. So just to say, in Michigan, and hopefully our intention is that this would be spread and shared easily across the US and hopefully elsewhere, is a training series that we are going to be creating with David and Hoda and parents. So what we're hoping to do is create a curriculum or an outline where each one of these important components will be co-developed or led by parents, providers and others in the field in a way that makes it most meaningful. Like I said, TikTok videos, messaging boards, storytelling. So we're very excited about what's going to be happening, but we spent a lot of time learning from the field about what's most important, not what we think is most important. So we've had some surprises, which I think are really going to make this that much better. So I'm wondering, in maybe a minute, we could just in the chat share a little bit about how a learning series, or what you've heard from the parents and providers in this survey, how this might lend to a training series. What might you want in a series that was available to you around early relational health to really impact your work that you're doing on the ground with providers, with home visitors, with doulas, with pediatricians? I know many of you are doing consultation with various populations.
So we welcome your good thinking, your responses.
Yep.
Your thoughts.
Yeah.
Ancestral work. Wonderful. The power of observational skills for both parents and providers. Absolutely. Being able to see, witness, experience. What else?
Oh, the importance of ancestor work. Oh, I love that. Love that.
You know, the generational experiences and messages and what's passed through generational awareness and knowledge. How about others?
Right.
I echo Mary's excitement about parents helping to guide the development of some foundational messages to those new people entering the career, so they can hear from the voice of families about how to be in relationship, what matters relational, what would be the most meaningful for them. So that's what we're really excited to learn from and test and bring forward.
I love these resources being shared about weaving together a bicultural approach. Yes. Okay, so many good ideas. We're recording, so we'll get to capture these, right, Lauren? Okay, great. The diversity-informed tenets, so important. Oh, these are such good ideas. Thank you, everybody. So it just seems like relationships and early relational health in general is a way of bringing us all together, no matter where we're starting in this work. If we've been around 25 years, no matter who we're supporting, if it concerns infants, toddlers, young children, and families, this grounding could be really, really important for all of us. So we appreciate you being here with us today and learning about some of these opportunities that we're learning from. And we would love to continue to hear from you as we continue to grow. And
right, and join our network. You can,
yes.
at that little website, website, there's you can receive, if you sign up, our monthly newsletter that talks about this, or come to us if you have ideas or thoughts you want to share out about how your work touches and expands this nurture, connection, relational health work and consultation opportunities. So join us in this journey of helping us learn together. So we really appreciate that.
Well, we have 2 minutes for questions. We know we don't want to keep you over for sure. The room closes in just a few, but hopefully I'm going to actually just put this back just in case people were jotting down the nurtureconnection.org. That's a great way to learn more and stay connected. But any other thoughts or questions that anybody has before we close our session today? Good.
We like to think that our relational health work is part of network weaving as a social movement from everything we've learned in our collective field of infant, early childhood mental health, public health, pediatrics, child health promotion, all the prevention promotion work. How do we come together? So help us along this social network, social journey. I'm sure all of you have thoughts about how that could be further elevated. We welcome all of that.
We're getting lots of thank yous and maybe a part 2 at some time down the line. So yeah.
We absolutely
Thanks,
need a part
Showcase.
2.
That's great. So I
That
wish you
flew
all
by.
yeah.
That absolutely flew by. Thank you. Thank you very, very much, Mary, David, and Hoda. That was absolutely fantastic. Thank you to all of you for such great participation and staying with us. We know we have another session starting in just a few moments, so we're going to do our behind the scenes transition. So thank you all so much, and we hope to see you soon.
Thanks,
Take
everybody.
care.
Bye-bye.
Thanks, everybody.